So let's look at the landscape. Let's look at the environment. We already covered this a little bit, but number one health complaint in our market, the number one thing that people suffer with is in our wheelhouse. And we talked about that. Top 2 reasons for being in a hospital, being born is number 1, and back pain is number 2, and that's according to 2 sources, JAMA and the Archives of Internal Medicine. So if you look at it, let me back up here. It says, the most prevalent chronic medical condition and primary cause of long-term disability, back pain, headaches, arthritis, and musculoskeletal disorders combined to cost employers. This is old numbers from like almost 20 years ago. 61 billion, it's much more than that now. What's the number 1 treatment now? So the number 1 diagnosis for an opioid prescription is back pain. That is our competition, and they are beating us at it. So the ideal practice, if you're given the responsibility to change healthcare, you know, I was going to take the slide out, and then one of our clients got up and gave a testimonial yesterday, and he said, you know, when I first heard Mike speak, he had this slide up and said, if you were given responsibility to healthcare, what would you change? And he said, that really like bothered me. And I thought about it and realized, holy crap, I'm not doing anything to change this. And that's why he joined us. And he was talking about how the wins he was having with it. And so I leave that slide in there because if you were given a responsibility, this is exactly how I looked at it. If I'm going to change healthcare, how am I going to do it? What am I going to do? What should a perfect practice look like if you take away the chiropractic versus medical versus PT versus this? What's the perfect practice going to look like? So what we created, what we thought was an ideal practice, treating the most common ailment that people have. Now we do have a lot of doctors that do functional medicine, meaning, she was talking about that, treating endocrine problems, right, through nutrition. I totally believe in that. My kids grew up, that was the only kind of physician they would ever see, was a functional medicine doctor, and he was a chiropractor, who was also a physical therapist. Mark Schwartz, anybody know him? Pretty famous guy. Having a medical practice where it's a professional medical setting, we pictured my mother-in-law being the perfect patient. My mother-in-law, if she walked into a practice and sat down at 88 years old, and they said, so Mrs. Murphy, we don't have, the nurse practitioner not here today, so we're going to have Dr. Eric take a look at you. She would say, who's Dr. Eric? What kind of doctor is he? And if she found out he was a chiropractor, she'd say, no thanks. She'd get up and walk out. She would probably say something like, there's only one good chiropractor on earth, that's my son-in-law, and I don't even let him adjust me. So we looked at that and said, how are we going to change healthcare if a lot of people are walking around with that viewpoint? So we set it up so it handles that viewpoint. People expect certain things from medical practice. When they come in, they expect to be greeted by a professional staff in an upstat environment. But when we do our rehab, we're not doing high-end rehab. You know the difference between high-end and low-end rehab? Okay, low-tech rehab versus high-tech rehab. You know what the difference is? How much does a consultant get paid for selling you the high-tech rehab? We don't do high-tech rehab. We do low-tech rehab. In a hospital, they do low-tech rehab. I'm not going to tell you to go out and buy $250,000 worth of exercise equipment. That's a scam. I'm going to tell you to go out and buy mat tables and get them online, and the price range you should be looking at is somewhere between $700 and $900, because that's what they use in a hospital. That's my practice right there. I mean, look, we got balance balls and Pedibond wobble chairs, and I have clients say to me, look, we have Dan Beeson in the next room. One of his associates, do you know Dan? One of his associates was Don Harrison. The guy started chiropractic biophysics. So I'm like, okay, Dan, you can do that instead of, you don't have to do what I do, but I do that because it works. We use those wobble chairs because it makes sense. You wobble back and forth and you can re-imbibe the disc as long as you're getting adjusted to break up the adhesions. And we've taken post x-rays on patients where they had a 200% bigger L5 disc at the end of their care plan because we re-imbibed it, right? You got to break those adhesions, you got to pump it in. But you don't want to do it, don't do it. What we're investing in is your staff. That's what they do in a hospital. We have systems to teach your staff on what exercises to do and what stretches to do, and then also in your medical personnel, how do you do the exam? There's no way you're going to hire a nurse practitioner or an MD that knows how to do, let alone an orthopedic exam, a functional physical exam to figure out if they have upper cross or lower cross syndrome. So what do? You teach them. So we do 10 trainings a year around the country. That's part of your program. It's no extra charge on how to do a functional physical exam. And most of the people in that room are usually your medical people. So last time we did it was in Atlanta about 3 weeks ago. half the room was nurse practitioners, the other half the room was chiropractors, and there was 3 MDs in the room. So the medical people outnumbered the chiropractors. Why? Because the medical people are going to be doing it because you're billing it under their license. So we teach them how to do it. Does that make sense? So we're doing low-tech rehab. Anybody in here have Vibe plates? They work great. How much do they cost? Vibration plate. $1,500. How much was yours?
I don't have one. I know
How much was yours? 900. Do you have them? Okay. So you know what it's stimulating, and the reason Dennis had that answer is because you have 2 Vibe plates. It stimulates the proprioceptive and mechanoreceptive joints, and that's what creates synaptogenesis. Vibe plates do work, but I don't pay $900 or $1,500 or $2,000 for them. I go to Costco and I buy a Bosu for $75, and that's what I'm going to tell you to do, because it does the same thing. And the guys who spent $2,000 for Vibe plates go, no, it doesn't. I go, oh, really? Here's my wife, who's a specialist in traumatic brain injury, who woke people up from a coma. I think what she does works, and the Bosu works just as good. You know what a Bosu is? It's a half ball. Stand on a half ball, you have a rail on the wall for them to grab. Does the same thing as Vibe plate. In fact, there's some research that says it does it better. And when I went in and bought 15 of them one time at Costco and wiped them out, and I did, it was less than $2,000 for all of them, because I had multiple clinics I had to buy them for. So I'm all about like cheap rehab, because it works. Which one's the chiropractor? Can you tell? Can you tell?
No.
You shouldn't be able to tell. We should be holding our place in healthcare because we have a very vital place in healthcare, or should, but we don't. So that's the future. You should be able to say, I don't know which one the chiropractor is, because they're all working together, and that's how this works. Our purpose is to stop opioids and stop all those other drugs and avoid surgery. Now, I got to tell you, when you become a medical clinic that has chiropractic as part of your team, you start attracting in people that you wouldn't normally get. So, for example, if I asked you, as a chiropractic office, how often do you get a patient coming in saying, I'm trying to avoid knee replacement? Does that happen very much? It happens, but not a lot. I had a 700 visit a week practice, and I think I can remember maybe 2 people that were trying to avoid a knee replacement. Now, what we do, can that help them avoid a knee replacement? Yeah. If you're going to look at somebody who's facing degenerated knees, what do you got to look at first? Q angle. What's Q angle? It's the angle of the femurs. If they're at the wrong angle, that knee's going to wear out, right? What causes that Q angle? What sets that angle? The orientation of the pelvis, right? So when you start looking at this, you start uncovering a whole bunch of things. This is how we should be looking at healthcare. So let me just go down this path. You ever take an x-ray of somebody and you're looking at the pelvis and one is lower than the other? What's causing that? Well, you could have an actual short leg, right? But how often is that the case? It's like less than 10%. It's usually an apparent short leg. So what is an apparent short leg? Yeah, so it goes just like this. And I'm preaching to the choir, so forgive me if you know this already. But the pelvis, let's say, here's my ilium, here's my ilium. When I take a step forward, it goes like that. And I go the other way, it goes like that. What's that called? Nutation, counter-nutation, right? What's the sacrum doing? It's rocking back and forth in a figure 8 motion. What's it pumping? Cerebral spinal fluid. Roger Sperry, you know who that was? A brain researcher, won a Nobel Prize for discovering that 90% of the nutrition and stimulation to the brain came from spinal movement. He's not a chiropractor. You guys should know that guy. Won a Nobel Prize saying you move the spine, that's what's responsible for stimulating your brain and pumping nutrition to the brain. So Roger Sperry. Roger Sperry. S-P-E-R-R-Y. So basically what he's saying is you get that pelvis moving, you're pumping nutrition to the brain. The guy who's got the PI ilium, when he walks, his pelvis is doing this. It's not moving. See, that x-ray would be normal if he was standing like this when you took it. But you have your patient standing like this, and it still comes out that way, which means his pelvis isn't nutating or counter-nutating, which means his brain is starving for nutrition and stimulation. So you go to adjust that patient with that really chronic PI. What's that like? You go do a side posture on him. What's that like? Holy crap. Holy crap. Boom. Holy crap. Right? Because you're like hitting a brick wall. So my MD's like seeing us go through all these gyrations in Pennsylvania. He goes, how about if I inject it? Inject what? Inject the SI joint. With what? Saline solution. Lidocaine. It's 99% saline solution. What's that going to do? It's going to lubricate the joint. So he does it. Clunk. Patient goes, what was that? I'm like, I don't know. All of a sudden, he said, look, you put the fluid in that joint, you stretch the joint capsule, you break the adhesions, and you lubricate the two bones, and it can move better. And next week, I'll do the other one. And then I'll do actually another one on Wednesday, and then next week I'll do one on Monday, one on Wednesday. I'll do a series of 3. Then we got paid, like back in the 90s, $300 a joint. I made more on those SI injections than I did on all the chiropractic in the care plan. And it made the patient better like that. The adjustments worked 10 times better. What I didn't put together was imbibition of a joint, or I'm sorry, imbibition of the disc is the same principle that all joints work on. It was my wife who said to me, I'm a physical therapist. What do you think I do? We range the motion of a joint that's arthritic to break the adhesions so it can pump the nutrition into the capsule. There's no direct blood flow into a joint capsule. If you had a blood vessel going into a joint capsule, you're either going to bleed into the joint or leak synovial fluid into the bloodstream. They all imbibe, just like the disc. I'm like, duh. I can't believe I didn't figure that out. So when these guys are talking about injecting the joint, and Janet Travell in her book is talking about injecting joints and trigger points, you're trying to use the the saline solution of the lidocaine to break the adhesions. And who was her test patient? John F. Kennedy, who was run over by a battleship in World War II, literally, and had a bad back. And she kept him out of a wheelchair doing these injections. If you read Bill O'Reilly's book, Killing Kennedy, he talks in there about, and every day in the morning and the afternoon, Kennedy's doctor came in and did her procaine injection. She was using a little bit stronger than lidocaine. But she kept him out of a wheelchair. She's the only non-military physician to ever treat a president of the United States. And the reason the Kennedys insisted on her is because of her non-invasive approach to breaking adhesions that happened to him by literally being run over by a battleship. You know the story, right? He's on a PT boat in the middle of the night trying to sink the battleship. Battleship doesn't know where they're at. They hear water moving. All of a sudden they look up. Here comes the bow of the ship. Ran him over. The captain of the Japanese destroyer or battleship didn't even know he ran over him. And it split their boat in half, went right across Kennedy's back. That's how he ended up with a back problem. So she treated it, and our program is based on how she treated him with the injections. Now, injections are not as profitable as they were back then, except some of them are. The stem cell injections are the most profitable injections there ever were. Would you agree? How much are you getting for an injection?
39.
We're getting $5,000 in Chattanooga, Tennessee.
It depends on the meals, like, how much amount,
Yeah, 1 mil. 1 cc, 1 cc, $5,000. 2 cc's, $7,500. That's what I'm getting. That's a 75% profit margin.
He doesn't know the number.
That's a 75% profit margin. And you know what? These people are totally willing to pay it. I was in my office like a month ago, and I was in there, and sometimes I go in and just spot check for quality control, and I'm sitting with the case manager, and this lady comes in and she goes, so 10 minutes? Okay. I went to your stem cell talk that you gave actually like a year ago. I go, yeah, I'm not in this state, and I'm not here very much. She goes, yeah. She said, but I went a year ago, and I didn't follow up on it. But then my sister Millie went to a doctor, and she got stem cell injections, and it completely fixed her knees. And I got a shoulder problem. And so she paid $4,000 an injection, so she whips out a checkbook. So I'm not paying more than $4,000 an injection. And how many injections do you need? 2, both shoulders. We're like, okay, done. She would have got it $500 cheaper if she didn't say that. But that's what these people are coming. No, we told her, look, it's $7,500. Look, second one, we'll charge you less. But still, these people are coming in like ready to do that. And you think, oh, these old people don't have money? Bull crap. 65% of the income or of the wealth in this country is controlled by people 65 years and older. But when they go to their AARP meetings, they teach them a phrase to say. And that phrase is, I'm on a fixed income. You know what a fixed income means? They got a whole bunch of money stashed away, but they're not getting a paycheck. So you prove to them that what you're going to do is going to help, they'll crack that bank open. And look, I did a lecture one time, and there's this woman in the back, and every time I'm talking about it, hand goes up, and she's complaining about something. I'm like, oh, God, who let this woman in the room? I was thinking about throwing her out. But at the end, when I do the stem cell lecture, and I say, look, so we do stem cells, I got to be honest with you, they are not covered by insurance. They're $5,000 an injection. Her hand goes up. I'm like, here we go. She goes, you mean to tell me that it's $5,000 for one injection, that's all I need? Yeah, probably, we'll see. But most people, it's like 95% of people, that's all they need. Well, they told me when I was going to get my surgery to replace my knees, it was going to be $15,000 out of pocket for me, and I have like a 50% chance of a complication. Why would I ever do that? I was like, I love this woman. That's the way it goes. I mean, who's going to, look, stem cells is a medical procedure, but the medical people are not entrepreneurial. It takes the entrepreneur to get them to do the procedure. And when they do the procedure, they go, holy crap, I've never seen anything work this good in my life. That is what they say. And if you're working with stem cells, you know that. So that's what we're trying to do. We're creating a more function-based model of healthcare. So you're going to have the devil on one shoulder and the angel on the other shoulder saying, oh, you should do it, oh, you shouldn't do it. So we're going to try to address some of these. This one I think I covered pretty well. What percentage of the population goes to chiropractor? We already covered that, 10%. Thank goodness you finally overcame your differences. When I first started presenting the model to patients, patients were saying, you know, it's about time you chiropractors stopped like resisting the medical world. I'm like, what are you talking about? Well, you're the only ones that don't play with everybody else. I'm like, no, we're the good guys. They're the bad guys. Oh, no, they all work together. The chiropractors are the only ones that stay off by themselves. You guys are a bunch of freaks. I'm like, that's what you think? And all of a sudden it started dawning on me, I was living in a little bubble. I had these patients I was treating that thought I was like some wizard with my hands, and I let it go to my head, and I realized I wasn't making near the dent in healthcare that I was trying to make. That actually when I brought the medical people in, all of a sudden I was able to tap into this segment of the market that would never go to us. And they were glad about it. Very few of our patients said, I'm leaving. I don't think any of them actually said that. So patients don't tell everything the chiropractor everything they tell the MD. Have you ever had a patient say to you, oh, I don't tell my doctor that I go to you? You know what that means? I'll translate that for you. I don't tell you when I go to my doctor. And they do, whether you like it or not. I had a client in Southern Illinois. She's like, look, you should come out to Southern Illinois, and Quentin actually did. You know, you guys know who Quentin is? He works with us. He's just in the room. He goes out to Illinois. He goes, there's no stop signs at the streets. It's like, I said to her, what do you do when the corn grows? She goes, you just drive and say a prayer. Because you can't see. It's flat, and it's just cornfields, right? This is where her practice is. 100% farmers she's treating. And she says to me, what are these guys going to think? If I start making triple my income, they're going to think I'm just in this for the money. You know what happened? They started telling her, yeah, we were driving really far over here to this other doctor and really far over. Now we just come to you. She has 4 practices now. Those people are spending money. There's a reason the bill for healthcare is $3.0 trillion a year. You know, they're spending that somewhere. That money is being spent. It's not being spent on us. So these people are going to other doctors. What will happen is they'll realize now you actually have a group of doctors that they actually identify with. When we surveyed the public, we'd ask them, who do you think controls healthcare? Overwhelmingly, they say the drug industry. Okay, do you like that? No, I think they're in it to just sell me drugs. So what do you do when you have a problem? I go to my doctor and he prescribes me drugs. They don't know what else to do. Do you understand that? If we're going to disrupt an industry, we better get into it and change it from the inside out.